Hi, I'm Candice here at Restorative Injectables, and today I have Bree here, and she is going to do a thread lift for her cheeks. So we've done a thread lift for Bree's cheeks in the past, but it's been almost a couple of years, and so it's time to do another one again. And she's a really great candidate for it because she's young, but she's also somebody who already has really good volume, and so we don't really need to add something like filler that's just going to create more volume for her. What she's interested in doing is lifting the existing volume that she has. So we can lift this area, and then she's also concerned with the look of her nasolabial folds, and we're going to do that with threads. Threads are basically dissolvable sutures that are going to go under her skin. They're going to stimulate her body's own collagen over time. So she can see a lifting effect from the threads themselves that actually lift her skin tissue, but then she's also going to get the collagen stimulation. So I'm just going to be marking Bree. To do the procedure, I'm going to be numbing her skin with lidocaine to keep her comfortable, making a little insertion with a needle, and the threads go in that insertion point. The procedure is generally fast, and most people find it pretty comfortable during the procedure. So to start, I'm going to be injecting a little bit of lidocaine with epinephrine. So a little poke and a burn here, and this is just to numb the area. I'm just going to let that sit for a minute. So they're numb for this, they generally don't feel it. And this site is where the threads are going to go in. So for Bree, we're going to put 2 threads per cheek. Before I do that, I'm going to add some additional lidocaine that's going to go under the area that we're treating. This is generally the most uncomfortable for this procedure because the numbing burns a little bit. So some things you can do beforehand before you get your thread treatment. You avoid all blood thinning medications like aspirin, ibuprofen, Aleve for about 2 weeks, and then avoiding alcohol for about 2 nights before your procedure. It really helps decrease your chance of bruising. So when I tie them up to get an additional lift, we know it's going to be a little more exaggerated in the beginning from me pulling tighter, and it's going to fall a little bit. So that's why I try to pull a little bit tighter when I'm doing it. And then that swelling is going to go down. You know, you'll look good by 2 weeks. You're really not going to notice a lot of that lift in the beginning, those first few days. Here's Bree before we move on to her other side. I just wanted to kind of show the side-to-side comparison. So she's got a little bit of swelling, but you can see she's already got a more sculpted cheek from the thread and more lifted here, which also, even though we weren't really targeting her lower jawline, it also gives you some lifting on your jawline as well. I feel like I see a noticeable improvement here around her mouth, which in her nasolabial fold and her cheek, which is one of the areas that she wanted to focus on.